In this video, we're going to talk about the symptoms, the intestinal complications, and the extra-intestinal complications of ulcerative colitis. So let's get right into it. Now, before we get into the actual symptoms of ulcerative colitis, I think it's really important that we understand what it means when we say ulcerative colitis. So all it is basically the inflammation of your colon or the large intestine with these open lesions or the ulcer formation. Now, for the most part, in most cases, ulcerative colitis will start at the rectum and it can progress throughout your colon and go all the way down to your cecum. Now, when it comes to the actual symptoms of ulcerative colitis, the very most common symptom is lower left quadrant pain or left lower quadrant pain. Why that is because your rectum and your sigmoid colon, that's heavily impacted by ulcerative colitis for the most people. It sits on the left-hand side of your abdominal cavity, more particularly lower left side of your abdominal cavity. So that's where this lower left quadrant pain comes from. Okay, and then the other symptom that most people do experience quite often is, when these ulcers, they start to bleed, this blood needs to come out of the body somehow. It usually comes out with the stool, sometimes even like watery diarrhea. So this is one of the other, or bloody diarrhea, I should say. So bloody diarrhea is another one of the most common symptoms of UC. And the third symptom I would want to say is, with this continuous inflammation or continuous bouts of this inflammation, what happens is you lose the ability or normal function, rectal function, right? The normal rectal function. And you have this false sensation of having to poop all the time during the day, multiple times, which is referred to as tenesmus. Tenesmus. Okay, so these are the three most common symptoms that people usually experience. All right, now that we're done with the actual symptoms, let's take a look at the intestinal complications before we get into the systemic complications of UC. The first one that we're going to talk about is bloody diarrhea, which is also one of the most common symptoms. The way it works is basically, you see how you have these epithelial cells inside your colon, or the colonocytes, the cells of your intestine, right? What happens is, with this continuous inflammatory response, you start to damage these colonocytes or the cells. When you damage these cells, there's a good chance that they will start to bleed at some point, especially when you have ulcers formed. Okay, so what do we have here now because of this injury? We have blood in your lumen of your colon, okay? And then on top of that, you have these little receptors, or I shouldn't say receptors, but the channels called aquaporins. And we use these aquaporins to be able to absorb the water from our lumen into our bloodstream, okay? And then if you destroy these cells, basically damage these cells, you automatically lose the ability to absorb enough water. And then that water will eventually start to pool up in the actual lumen. So now what do we have so far? We have blood mixed with actual water, right? And it needs to, again, come out somehow. Usually, for the most part, it will come out as bloody diarrhea. Okay? That's your first complication or intestinal complication. The second one is the bowel obstruction. If you continue to keep on inflaming your bowel over the long period of time and you don't seek medical attention, what happens is your immune system kicks in, okay? And it tries to basically repair the actual wound that's inside of your intestine because of this inflammatory response. Now, part of the wound healing is laying down the fibrotic tissue. And when you start to lay down the fibrotic tissue, what happens is you start to narrow the actual lumen of your intestine. When you narrow this lumen, you see how it's becoming more narrow over time? Now, anything that's proximal to this obstruction, so it could be fecal matter or fecal material or waste products, they may start to accumulate proximal to this obstruction, right? What is it called when everything starts to kind of like store proximal to this obstruction? Called bowel obstruction. Okay? Bowel obstruction. Now, bowel obstruction can cause some of the particular symptoms because of the gas buildup and everything. Some people may experience nausea, vomiting, or even reflux in some cases. So that's your second most common complication. Well, I shouldn't say most common, not in the UC, but then it can be a problem. In Crohn's, it's very common, by the way. Now, let's see the third complication, or intestinal complication. What happens, and this is one of the most, I want to say, scary complications, and then people need to, or their doctors, or medical professionals are usually worried about. It's called toxic. I'm gonna put it down here. Megacolon. This is a bad disease, right? So, or complication. What happens is, with continuous inflammation, so far you're damaging the actual epithelial, or the innermost layer of your intestine, right? Intestinal wall. But over a certain period of time, it can start to hit the deeper layers of your intestinal wall. What do we have in the deeper layers of intestinal wall? We have the nervous tissue, or the nervous system tissue, more particularly the enteric nervous system, right? You see these little green nerves? They're basically part of the enteric nervous system. If you start to damage these nerves, and the role of this nervous system is basically to generate contractions to be able to make or generate the peristaltic movement. So being able to move the food or the fecal material down the tract so you can eventually defecate, right? You contract it and you basically defecate later on, right? Now, if you damage these nerves, are you going to be able to generate contraction to the smooth muscle of your intestinal wall? No. So you reduce the amount of contractions, okay? And to make things worse, the other thing that happens is we don't really understand whether it comes from the actual bacteria that's present inside of your colon, or if it's the damaged colonocytes that produce, or I want to say the oversynthesis or extra production of nitric oxide, which is a muscle relaxant, right? What it does is basically further relaxes the actual smooth muscle of your intestine. Now, you're not generating any contractions. On top of that, you're relaxing this muscle. What happens is, if you're not contracting this muscle and you're relaxing it, you're not going to be able to move the feces or the waste material throughout your actual colon and to be able to defecate. So it starts to pool up in this area. Now, what do we have here? We have feces. We may have some bacteria, which is your part of your flora, and you have toxins, or different types of toxins inside of your lumen, or the colon. And what happens is, if you keep building up this waste material in this area, at some point you start to build up lots of gases, and eventually you will start to dilate or distend the actual colon. So like, you're gonna start to see some sort of distension, and if it goes greater than 6 centimeters in diameter, that's the telltale sign of toxic megacolon, or the initial states of toxic megacolon. Now, once you hit this part, there are two things that happen. Number one, when you keep on distending these walls, they become more thinner and they lose the integrity of the actual protective barrier that holds the bacteria and toxins inside of the lumen and doesn't really let them go into the bloodstream. However, when you're losing the integrity of that barrier and you're making it thinner, the first thing that happens is, or can happen is, this bacteria and the toxins can actually translocate into your bloodstream. Now, what happens when you have bacteria going into your bloodstream? The systemic inflammation, right? Systemic inflammation. Now, this is basically the initial state of, I want to say, sepsis, right? It can progress to sepsis if not treated on time. And in worst case scenarios, can also lead to septic shock. Now, the symptoms with these could be higher heart rate or even higher fevers as well at the same time, okay? And the other thing that happens is, because you're making these walls really, really thin, there's always a risk of perforation. When I say perforation, meaning you can actually burst open the actual intestinal wall, right? And then if you burst open this or rupture the wall of your intestine, this bacteria has the opportunity, and the toxins have the opportunity to actually go into your abdominal cavity. Once these things are in your abdominal cavity, you know how you have a thin layer of tissue or thin tissue that's called peritoneum that layers your abdominal cavity? These things can actually go and start to infect that tissue, right? It's called peritoneum. If you infect that and you start an inflammatory process there too, it's called peritonitis. Tonitis. Okay. All right. This is also one of the very scary complications. You have to watch out for that too, okay? And the last but not the least complication that I want to talk about is this is also one of the very sad situation for it doesn't really happen right away, but then it takes a very, very long time unless you say if you're not taking care of it or you're not getting medical attention, there's always a possibility, but it takes years and years of inflammatory process inside of your colon to be able to get to this stage. Now, this is called colorectal cancer. There's always a risk of it. The reason why is because when you have continuous injury, the injury to your colon, you're trying to keep on making new cells. When you keep on making new cells, there's always a risk of genetic mutations or making some sort of error or the mistake during the replication process. Also, some of these immune systems, they can directly damage, by producing some reactive oxygen species and stuff, they can directly damage the DNA of your cells. What happens when you damage the DNA? There's always a good chance of mutations, right? Well, if you have genetic mutations, this can lead to abnormal production or overproduction, or I want to say overproduction and the abnormal looking type of cell production, which can lead to colorectal cancer eventually. And now that we've covered the intestinal complications, let's quickly take a look at the systemic complications or the extra-intestinal complications outside of your intestines. So the first thing I want to talk about is, how there's a overproduction of these pro-inflammatory cytokines that we've talked about in the previous video as well, and the immune response. If you want to check that video, go take a look at that video so you can actually understand what the process behind this immune cascade is, right? So what happens is you release these cytokines. We're not going to go into every single one of them because there's so many. But what happens is these cytokines, they can basically go to different tissues of your body. The first one is they can come to your eyes. Now, you have a part of your eye called uvea. It loves to actually hit that part. Okay, when you hit that part, you initiate the inflammatory process in your uvea. It's called uveitis. And it can present with red eyes or very, very painful eyes, okay? And the other thing these cytokines do is they can go to your liver, and they do two different things in the liver, by the way. The first one is it can upregulate the production of clotting factors, okay? And downregulate the natural anticoagulants. What that does is it creates an opportunity for those clotting factors to form unnecessary clots inside of your body, for the most part in your deep vein, so like your lower limbs, okay? They come out here, they start to create a little clot inside your deep veins. Now it could be, there are different locations, we're only going to pay attention to this part here. Now, what if you dislodge this little clot? It can move up through your circulation, go through the heart, and can also get stuck inside of your pulmonary arteries, right? What do we call it when you have a clot inside of your pulmonary artery? What happens with that? You have pulmonary embolism, and this is called deep vein thrombosis, okay? Now, both of them together we basically refer to as venous thromboembolism, or VTE, all right? And the other thing that these cytokines can also do when they go to the liver, they can actually hit the biliary ducts. So intrahepatic ducts and the extrahepatic ducts. So you see how it's getting red, basically? You're inflaming this tissue, right? When you inflame this tissue, what's the name of this disease? Primary sclerosing cholangitis. Okay? Now, here's the tricky part with this disease. What happens is If a patient has ulcerative colitis, that does not automatically mean that they will for sure have primary sclerosing cholangitis. However, it's quite the opposite, the other side, right? If you have primary sclerosing cholangitis as your primary diagnosis, there's always a good chance that the person may also have, or at some point will have, ulcerative colitis. Okay, so that's a bit of a tricky part with that. And the last extra-intestinal complication I want to talk about is general arthralgias, or like the pain, joint pain, or arthritis, or different types of arthritis. What happens is these cytokines, and there are other mechanisms involved in this process, but we're only going to pay attention to the actual cytokines. They can also come out here. They love to hit the actual joints of your body. So primarily, I want to say the elbow joint, the wrist joint, and your knee, on also your ankles, and they can also hit your spine. Okay, so when they hit the spine and the sacrum region, it's called spondylitis and sacroiliitis. So you will have some sort of pain in your elbows, wrist, or knee, or even your ankle. So these are the things that we need to watch out for. Okay, I'm just gonna make a little arrow here. All right, so that covers our symptoms, the intestinal complications, and the systemic complications of ulcerative colitis. However, there's another one that I want to talk about, is the skin complications. Some people can also present with these conditions called pyoderma gangrenosum, and also the other one is erythema nodosum. So we also have to watch out for that. Other than that, I think we've already hit pretty much every single complication that we need to talk about. And if you have any more questions, please leave them in the comments below, and I will try to answer all those questions. Also, if you like this video, please give us a like, and also subscribe to the channel so we can continue to make these educational videos for the future. Thank you.